Hey everyone, Dr. Andrew here with Thrive Chiropractic. And tonight we're going to be talking about speech delay and apraxia. And right off the bat, I want to ask for a favor from you. If this is making sense to you, if by the end of this video you feel like it could help or be valuable to some other families, please like it, please comment, please share questions, share feedback, and please share it, because there's so many families who are struggling, there's so many kids who are dealing with these issues, and that's our mission at Thrive, is to help less families be frustrated with the struggles affecting their everyday life, and less outbursts, less tantrums, less just fighting between parents and kids and everything like that. So please help us accomplish that as we're sharing tonight, because the reality is that these challenges are tough for kids. They're tough for families. It's such a struggle when a child is not able to communicate, and that affects so much more than just that kid's relationship. It's, you know, the parent is frustrated because they're not able to understand what the child wants. The child isn't able to verbalize, you know, what's bothering them or what they really want, or if they want to eat this or that. Or there's so many things that get wrapped up into communication issues. And that's what we're trying to set free. That's what we're trying to unlock and create a better life for families. And if this is you experiencing it, if you've been there, you know exactly what I'm talking about, because it is such a frustration. It is such a butting of heads when you're not on the same page, when you're not able to relate and communicate. And ultimately, if you're tuning in here tonight, I'm pretty sure that I know what you want, and that's what every parent wants, which is just the best for their child. They want them to reach their full potential, whatever that means for that family. You know, we don't exactly know what it means for each kid, but you want them to be the best version of themselves that they can be, and that's exactly what we want to do at Thrive here. We don't want to change any kids. We don't want them to be any different than what they are. We just want them to be a better version of themselves. So if that's you, a parent who's just frustrated and worn out and exhausted from the constant battles with communication, and, you know, constantly going to therapies and extra things to help your child have success and achieve the next developmental milestone, you're in the right place. That's what we're going to talk about here tonight. And what we want to do is provide what you're looking for, which is answers, which is hope, which is help, things you can do for your child in these situations. So please stick with us. Chime in. I'll try to monitor if there's any questions both now or later on down the road after we wrap up this evening. And we'll be happy to answer any questions you have and further that dialogue. So to really fully understand how we can help with challenges like speech and apraxia, because I know some of the conversations right in here in the office I was having earlier today, I was kind of joking around with kids, like you were talking about this webinar we have going on, and we're like, what does poking around your back and your spine and your nervous system have to do with being able to talk better or communicate more efficiently or have better motor control of your tongue? Because that's what most people's impression would be, is, well, chiropractors for when you have a headache or back pain or anything like that. I think you're going to see that that is definitely not the case. But really, to fully understand why, we need to backtrack. We need to get to the why behind a child is dealing with these issues, because if we understand that, we can understand what we can do to help. So we're going to start all the way back at the birth process. That's what we do when we have a family starting care and we have a little one who are trying to really get to the bottom of why they're struggling with development or milestones or any sort of neurological checkpoint. We got to start talking at birth. And what should birth be? Birth should be an amazing, beautiful, empowering experience, both for mom and for baby. When everything is going as it should be mom and baby calling the shots, that ebb and flow, that beautiful symbiotic relationship of hormone escalation and calming down, and baby maneuvering into the right position, and mom following her instincts. And it's when everything works well, when everything goes as it's supposed to, exactly that. Unfortunately, most pregnancies, most births these days are far from that experience. It's usually a stressful and fearful intervention-based pregnancy leading to a stressful intervention, fearful birth process as well. So whether that's getting induced with Pitocin or having an epidural and not being able to move into different laboring positions, ultimately what it leads to is, instead of baby coming out with mom's input and nothing else, it's some sort of help along the way. Maybe even before we get to that, it's forceful, too forceful of contractions or poor positioning in utero that causes extra strain on the baby. But even if we don't deal with those things, usually as we're entering the world, there's maybe doctor's hands pulling or twisting at that precious head and neck, or maybe it's even more significant, or forceps, vacuum extraction, C-section, things like that. In one way or another, there's some sort of intervention and there's some sort of disturbance to that normal process. And as thankful as we are that that takes place and that can make sure that we've got healthy mom and babies on the other end of it, it's not without consequence. And as we've seen the incredible exponential increase in the rates of birth intervention, we've seen an incredible increase in the rates of what we call the perfect storm pathway, which is anything from, kids with ear infections to kids with ADHD and sensory processing disorder. And this definitely fits into that conversation as well, as you're going to see. So we've got, going through that pathway then, we've got a newborn who more often than not is starting off life with some sort of stress and tension within the neurospinal system, but especially at this top part of the neck. As many as 99 out of 100 healthy newborns are starting with this disturbance to their spine, according to some research done by a group of osteopaths in Europe. So that's what we start with. We've got a kid who's got a bit of what we would call a kink or a misalignment or a fixation within their spine, but more importantly, within their nervous system, because that is what our spine is surrounding. It's surrounding our spinal cord, which is simply an extension of our brain. And especially up top here, that spinal cord is surrounding what I call the air traffic control center for your brain and for your nervous system, because this brainstem runs all of our growth and development functions. It's like it's more of the primitive brain. So if its needs aren't met, if our primitive brain doesn't feel like the world is working as it's supposed to, then the higher level development that we need for something like speech definitely is not going to happen. So this is what we have. We've got some birth intervention, trauma, twisting, pulling, turning at that head and neck, leading to some damage, leading to physical misalignment and fixation, some sort of, we'll call it scientifically, stuckness in that area of the spine. And what that now is going to lead to is an imbalance within how the brain and the body and the nervous system is operating. And we can think about that in a super simplistic way. I know we could get really sciencey here, but we don't need to. Let's talk about what we call the gas pedal versus the brake pedal. Your body has two modes or two halves to it. We have one side or one mode of our nervous system, which is our gas pedal. You might know of it as the sympathetic nervous system or our fight or flight, go, go, go mode. This is great if you're walking in the woods and you see a bear and you need to fight the bear or you need to run away. It's great for survival instincts. It's not so great for everyday life, because if we're stuck in survival mode, if we're stuck in gas pedal mode, if there's too much stress stuck on, it means that the other side doesn't get to happen. You can't be in growth and protection mode at the same time. If you're fighting for survival, you don't really care about optimal development. And that's what the other end of the spectrum is. That's what we call our brake pedal. That's what you might know of as the parasympathetic nervous system, or our rest and digest mode. So that parasympathetic nervous system, that is our growth and development. That's rest and relaxation. That's where our immune system is doing what it's supposed to do. That's where our, we're digesting lunch as we're supposed to. Everything is balanced. Everything is at ease. And we need both of those modes, but we can't get stuck in gas pedal. We need to kick it into high gear and then come back out of it and calm down. We don't want to constantly have the adrenaline pumping. And so your body's really smart. Your body's really intelligent. If it doesn't feel like it's safe, if it doesn't feel like its basic needs are met, those higher levels of cognitive development, those upstairs functions, are going to have a lot harder time of happening. And you could, if you're familiar with something like the Maslow hierarchy of needs, right, you know that your ultimate higher emotional, cognitive needs can't be met until your basic primitive survival stuff is being met and being accomplished. And that's exactly what we're talking about here, that if a child, if any individual is stuck in this gas pedal survival mode, if their nervous system is not thriving, if it's not in growth and development, then naturally milestones are going to be a struggle. Speech, emotional regulation, tantrums, all these things are going to have a more difficult time happening. And this can refer to multiple perspectives. It could be both the motor control as well as the more higher level brain functions like we're talking about. Because simply from the motor control perspective, like a lot of times we talk about the big component of apraxia is physically the ability to form the words. Well, this area of our spine, our nervous system, the nerves coming out here are the ones that are controlling the jaw, controlling the tongue, controlling the formation of those words. So it really affects everything that we would need to have working properly if we were going to have optimal speech, optimal cognitive development, all of that. So if that gets turned off, then naturally the byproduct is something like apraxia or speech delay or a lot of the other perfect storm pathways. So without talking with every single one of you who's listening or joining us in one-on-one, what I can tell you is I probably have a general idea of what some of your child might have dealt with is, without ever having met you, without ever having had a conversation, because we see the same pathway, we see the same process over and over again. When a child has a stressful birth, when they have a rough start to life, where they have too much gas pedal, too much stuff going on up top, Usually it starts off as a baby who's a little more fussy than most. They don't like to sleep as well. They don't like to nurse as much. Maybe they prefer one side over the other. Maybe they didn't really latch or connect or breastfeed at all. Oftentimes these little ones are pretty refluxy. They spit up a lot. They're having some issues in that regards. And it's just a not happy baby. But what we're often told, what is often said, is they'll grow out of it, right? It's temporary, no big deal. Colic, reflux, anything like that, they'll just grow out of it. And while it's certainly like, most of us don't have reflux as adults, it's not exactly what's taking place, because they don't really grow out of those initial challenges. They really grow into the next one, because we see that baby that's struggling with those things turns into the 6 or 12-month-old who's then dealing with a lot of ear infections. And now all of a sudden, because we've got this misalignment and fixation up top still, which is affecting our ability to turn, ability to rotate, which would mean we can't nurse very well. The nerves coming out here are affecting the valve that closes off the esophagus, which leads into the stomach. So if we don't have that working, we're going to have reflux. The same nerves, the same areas are controlling the ability of our tubes to drain, right? We hear all the time, well, my kids' tubes are just more horizontal as a little one compared to an adult, so the fluid sits there and they get the ear infections. And I know this isn't an ear infections webinar, but I can't help but at least say that that's not really the case. Our ears don't drain because they're not horizontal. They drain because there's a fluid pumping action. There's a muscle that squeezes the fluid out of there, just like you'd squeeze the toothpaste out of a tube. So what's really going on is that the muscle within the eustachian tube that's helping the ear drain has tension on it, has asymmetrical tension, because there's misalignment in the top part of the neck. And what that is then going to lead to is, yes, fluid staying in there. And if fluid stays anywhere in the body, it's usually going to lead to infection and other issues down the road. But of course, then we can get tubes, all the problems solved, and on with the rest of our life. Well, you can see where this is going now. Same problem remains. The problem is just going to go into the next thing, which usually turns into more of what we're talking about now with speech delay, speech apraxia. A lot of times tonsils and adenoids end up being really inflamed, really swollen, because now that fluid is draining, but it's still an issue. There's still dysregulation within the immune system. It's not balanced properly. And now I've got a kid whose tonsils and adenoids need removed, because those are just spare parts from IKEA that your body didn't actually need. And it goes on and on and on. We could walk through that pathway and how we see it lead to kids dealing with much older struggles. But those are really just the first couple steps that we often see in a child who's dealing with speech delay or apraxia or anything along those lines. Because whether it's the fluid in the ears that prevents them from being able to hear and articulate well, or whether it's the motor and the higher level of brain development that doesn't really get wired properly because of the stress and imbalance within the nervous system and that air traffic control main center, one way or another, something is preventing them from developing and progressing as they're supposed to. And that's really as simple as we can put it, right? What we do about it then, which is kind of what we were hinting at earlier, is very different than what you might do with an adult or someone who's dealing with other challenges, because adjusting a kid is a lot different than adjusting an adult. And that's the thing I tell people over and over again when people are reaching out to me from somewhere that's not within our local region that can come to us directly, is they want to find a chiropractor to help their child. And it's not always really an easy process, because you can't just go to any chiropractor and say, hey, my child's dealing with this and I need help. You need to find someone who has specific pediatric training, and not just pediatric training, but pediatric training who can help and is familiar with these neurologic conditions, that probably does the scans that we're talking about and everything along those lines. So finding that office, finding us here at Thrive, what we're going to do then is correct that underlying cause that we've been talking about. We're going to release that tension. We're going to help restore proper balance and motion within the top part of the neck with very gentle, specific adjustments, which then undoes all of that negative sequela we're talking about. Now, those nerves, especially the vagus nerve, which runs the brake pedal, they can come back online. Our body can have the proper balance with the immune system and digestion now. We can articulate our words better because the motor neural pathways are more streamlined and more smooth and more turned on. And basically, we're just pumping the brakes, allowing normal development to come back on track. So we do our scans that finds the stress, and then we keep monitoring that throughout care to find, to make sure that we get to the bottom, we get to the root causes that are contributing to these issues behind the scenes. So one other note on that, really, the sooner the better when it comes to kids, because there's developmental windows that are closing as they age. And that's not to say that if we have a kid that's 8 or 9 or 14, we can't help at all. It's just that we could have helped so much more if they were 2 or 3 or 6 months at that point. And honestly, it's going to be a lot quicker to help at that point too, because those challenges and the stress in the nervous system has had less time to really set in and be locked in there. So one thing I've got to mention here as well, as far as things you might be thinking, because I know some of you are like, well, there's so many, especially if we've got a provider listening in which I would love to connect more if we do have any speech pathologists or speech therapists that we work with that are tuning in here. I'd love to further chat further about this. But some of the stuff you're thinking is probably like, well, there's so many different types of apraxia or different causes, or maybe even you're not hearing me properly and you're thinking, whoa, are you saying you can cure apraxia? That's not how that works. The kid has it forever. Trust me, that's not what I'm saying. To clarify, I'm a pediatric focused chiropractor. I'm not going to be assessing your child for a speech delay. I'm not going to be diagnosing them with apraxia or walking them through speech language therapy. And our care isn't a treatment for those things. It's not a treatment for speech delay or apraxia or anything, which might sound confusing compared to what I was just recently talking about. But that's not to say that we haven't had countless kids in this office talking, speech exploding after starting care and being able to communicate better. But that's different than treating it directly, because that's not even close to what we're doing. We're helping their normal development. We're helping their normal neurologic function, their body's internal operating system work better. We're pumping the brakes and just allowing them to develop as their brain is hardwired to do. Our default mode is to heal, right? We just like when you were growing a baby, you didn't have to wake up each morning in pregnancy and say, all right, don't forget the fingers, don't forget the toes, let's make sure we have the spleen, the kidneys, all this stuff in there. Your body just knows what to do. And that's the same thing that's true of your kids is they know what to do. We don't need to intervene, or we don't need to add to that. We just need to make sure that there's nothing getting in the way of them expressing that optimal health and optimal development. So please don't stop your speech therapy. Don't stop your speech language pathology. Seek out those services if you don't already have them. We love working with them. We love having some of our partners in the area combine care with some of the kids that thrive here, because we see exponentially better results when we're working hand in hand. The speech therapists love it because the kids who maybe had reached a plateau or who are just starting out care, now results skyrocket and we see words coming out at a much higher rate than they were previously. So we love working with speech therapists, and what I always say is it's a synergistic 1 + 1 = 11 sort of relationship. You get better results out of both when you're able to do that. So find an awesome speech language pathologist and continue in care with them. We're just going to make their life and your life easier. So maybe it's less weeks, less months of going to those sessions and everything like that. So ultimately, I just want the same thing for your family that I want for any of the other families that we've cared for, whether it's, I can think of multiple little 2-year-olds or 1.5-year-olds who came in kind of on the early phase of that, dealing with ear infection after ear infection after ear infection, who a couple months into care, parents are like, oh my gosh, their speech is exploding, they're talking so much more, they're verbalizing so much better, because those pathways, because those neurologic issues are clearing up. Or maybe it's older kids. I can think of so many who reading comprehension has skyrocketed and they're able to communicate better and are thriving with that. And even a little boy, James, who had that speech apraxia diagnosis and now doesn't, completely was removed to it. So that's how we feel about a child being told that they can never leave that diagnosis. So reach out, see if we can help. Any new patient relationship with our office always begins with a complimentary consultation, and that's a chance to just learn more about what we do. There's no pressure, there's no compulsion to do anything. It's truly just a conversation, not a commitment to anything. Should you want to figure out if we can help with anything, that's when we're going to dig in. We're going to do our deep perfect storm case history, kind of uncover some of the factors that could be involved here. We're going to do our physical exam, and we're going to definitely do our scans, which are the ways that we can objectively measure and quantify how your body is functioning behind the scenes. What's going on internally, not just the symptoms or the external stuff. And then finally, the last step of that new patient relationship is what we call our patient recommendation conference. And that's where we're going to sit down and we'll say, okay, this is what we found on the scans. This is what it says. This is what we would recommend for care. This is how long it's going to take, what it's going to cost. And at that point, you don't have to do anything, but at least you'll know. At least you'll know if what is going on with your child is because of this tension, this stress within their spine and within their nervous system. So appreciate you guys joining us. Appreciate you tuning in. And like I said, reach out, let us know if we can help, and I can't wait to meet you in the office and help your family thrive.